Hello and welcome to the video series coming onto running gait analysis. An important part of managing running injuries is looking at the running gait and also when we think we should intervene. In many cases, we may not intervene because the problem is on the load management or strength deficits and other areas. But in some cases, especially like knee pain and medial tibial stress syndrome and those sort of cases, altering your gait analysis can be a very powerful component of managing. So it's an important piece of the puzzle. We need to know how they run, what's the main aggravating factors, and what capacity do they get, at what intensity do they get pain? Do they get pain after 40 minutes of running, or do they get pain only with speed work? So those areas are really important for us to highlight and also to explore in detail as well. So some would say there's not much need to change that, we should let it go naturally. But when patients come to us with pain, we have to look into all aspects, and it doesn't mean just looking at somebody's skill running doesn't mean that we're going to change it. So if you look into other sports like swimming, tennis, golf, and other sports where we have skill, we look into their how they move, and the same thing is with running. Running is a skill, and we need to look how are they being effective, are they being more efficient, and is there something we can do to reduce the pain. So the idea here, the whole point of this series is not about performance, but looking at injured population. Although you might improve performance with some changes, which I'll explore with running economy, but the main emphasis here is looking at practical running gait analysis in an injured population, and then whether we can make a difference. So the aims. So looking at the key aims here, humans are born to run, we can say, but techniques can be coached, trained, and improved. When we young, we naturally progress from crawling to walking and running, but that desire to explore, but like with anything in life, you can always improve it. So there is always that skill element to it. So we're going to look at an overview of practical running analysis in injured population, common dysfunction linked with injury, how can we optimize it, and definitely the practical consideration. The idea here is to change tissue loading if indicated and to reduce pain. So the main emphasis is on symptom improvement and also to reduce the pain if necessary, reduce pain if you think it's linked with their running mechanics. And the evidence is slowly emerging. So this is coming from JOSPT, which was sort of published a few years ago, where they looked into gait analysis, and what they found out was mirror and 2D video feedback were quite a potential methods for running gait modification in a clinical setting, especially in conditions like patellofemoral pain and chronic exertional compartmental syndrome, CECS. So, and the evidence have shown the use of real-time visual and audio feedback can improve running form, and you can see the cues can be given. So the implication is the clinician should consider the use of real-time visual and auditory feedback in treating runners with VFP who present with frontal plane hip and pelvis deviation. So, and their conclusion was no recommendation can be made with regard to implementation other than patellofemoral pain and CS. But now we're getting more and more evidence for other areas as well. So it's definitely worthwhile looking and how we can implement that. So mirror and 2D video feedback is one good option, but there are also other options to look into. And when we look into performance and running economy, certain characteristics can help us massively in improving your running economy. And this is sort of a key paper for Folland et al. In 2017. And what he looked at is the top 3 recommendations and consideration. And he found out the running techniques is an important component of running economy and performance. And there's a considerable variability in running economy technique from 39% to performance to 31%. So based on this research, there are some sensible practical consideration we can always improve in a runner, regardless of what type of foot strike they have. It depends on also their experience. One is higher cadence will reduce their ground contact time and minimize the braking. So that will make you more efficient. You're spending less time on the ground and more time in floating, which also makes you more efficient and less likely to get impact injuries. The second is vertical oscillation, which is jumping up and down, where you bounce. A bit of bounce like 5-6 centimeters, 8 centimeters is normal. Anything more than 10 centimeters is considered to be excessive. So if you're having excessive bounce, then you're increasing the impact forces. That could potentially lead to overuse injuries such as the knee and the foot. So that can be changed by increasing cadence or by visual or auditory cues. The third is excessive trunk movements like side to side, hip drop, rotation, and that can be changed by using cues like run tall or look up from the ground to horizon, and effective arm swing can also reduce excessive trunk rotation. So these are quite good changes which we can use with any runner, regardless of their experience, regardless of the foot strike. Good high cadence, although the evidence doesn't tell us what is the best cadence, but we know it's a range. With my patients, I aim for a cadence of anywhere from 170 to 190. If they're more than 170, I generally don't change it. And we want to reduce excessive vertical oscillation, and we definitely want to prevent excessive rotation of the trunk, which is just leading to more energy expenditure and make it more efficient. So definitely your style of running has an effect on your running economy and also your performance. And generally people think running is just a cardiovascular exercise, but it's not. It's beyond that. You need some strength characteristics, you need to have good mobility, strength, efficiency, and there is also a motor skill involvement as well. So that is something which some will pick up easily, but others will need some more guidance accordingly to pick it up more in an effective manner. So with all sports we can improve techniques, so same thing applies with running as well. So we need a combination of good cardiovascular fitness, strength and skill elements. So you need a combination of those. So so when we look into that, so we're linking sort of all those three components here. So when you look for gait analysis, we are looking into overall running kinematics, the foot strike, transition, stride length, step rate will all we go through. So is there an ideal gait? We'll be talking about shortly about that. What's the best way to look into that in a second. There is some element in genetic combination as well. So if you can see here, so the general focus on too much on the foot strike, but for me, if you look at the hip extension here, you got three runners all training at the same center, and you can see a Caucasian runner with the hip extension. You can see Mo Farah, who's got an East African background, having a tremendous hip extension, how much he's covering with each stride. So sometimes it's a bit of a genetic component as well. If you're blessed with good mobility, good stiffness of your tendon, then obviously you're more efficient. So those elements can't be underestimated. So you see people from East Africa, from Somalia, Kenya, those areas, they generally are more efficient in long distance running. Could be their body type, could be the way the tendons are, and also the recoil force. So certain factors can't be trained, certain factors are intrinsic, and certain races might have some advantages as well. And there is also some emerging evidence on different types of running style as well, where this is something called grounded running. So this is a term launched by Dr. Martin Shorten. It's basically a form of slow running that is characterized by its absence of a flight phase. So this is something which could be used in injured population. This came from, I think, from Belgium. And what they looked here is you can markedly reduce your MSK loading by up to 30 to 35%. So it could be a solution for people who are prone for injury. So here we're looking at a slower speed between 5.5 to 8 kilometers per hour, no flight phase, and it's a flat running side. So it's more like a brisk walking style. So again, it's only a few bit of research here, so we still have to see whether this might be effective for the injured population. So that's something to be aware of, is this grounded running or a more flat running style compared to your traditional aerial running style as well. So we might see more of these different styles which could be relevant for certain runners. And when we talk about gait analysis, we have to remember most clinics will not have access to highly advanced force plates, 3D systems, and muscle activation and EMG material. So we have to remember, when we talk about gait analysis, is a combination of three factors. Kinematics, quite a simple way of looking at it, is motion. How much is your range of motion when you run? How much is your hip? How much is your ankle? How much is your knee? Kinetics is the forces. And third is, and that's where you need like a muscle, force plates and other thing to actually measure. But nowadays we're getting wearables, which are devices which you can put that in your shoes, or external sensors which can help us to see the forces. Third is the muscle activation recruitment, that you might need surface EMG and other electrodes. So we have to remember, like in most clinics, when you're seeing the information, we're only getting 1/3 of the information. So we're only looking at motion, we are not looking at the forces and the recruitment, so it might not tell the whole story. That's why in the future we might have more accessible equipments in the clinic where we can look into those bigger picture rather than just looking at motion kinematics than looking at forces and muscle recruitment. So in reality, what we're going to use, what I personally use in clinic and what I've been doing for the last 8-10 years is 2D video running analysis. So that's more than adequate for most common problems and for most common runners, recreational. And we're not looking at giving shoes or for pronation or for shoe selection. Here we're looking at the whole body. We're looking at the consequences of an injury. We are not looking just at the foot. We're looking at the whole trunk. And we want to see how the whole video analysis of the whole body, how the body is interacting, and how each movement might be contributing to tissue overload, and also see how we can make it more efficient. And also, most important, trying to see whether there's a link with injury. It's all about injury, and there's not much point looking at gait mechanics if we don't know their injury history. So for me, the injury history is massively important, and to see how that fits in. So let's go straight into some practical components here and see how we can help with gait analysis. So by far the most common which you're going to see is knee pain and shin splints. They seem to share some common gait characteristics. So one thing which we see here is overstride is linked with higher impact. A heel strike with an extended knee can generate very high impact forces on the lower extremity, whereas a quiet midfoot or forefoot strike might not have less. So the farther the foot is in front of the body, the greater the vertical loading force. The more you overstride, the harder the foot slams down. So generally we're looking at a combination of overstride, low cadence, and a straight knee, and they might have a vertical bounce or excessive lean. So for me, the most important is the three: is overstriding, very poor cadence. We're talking about 150, 160s, and when they're landing with the straight knee, which I'll go through an example in one of the slides. So one, I'm looking at how farther they are from their center of gravity. The more they're further, they're more having impact forces. So this is quite so overstride is commonly associated with creation of greater braking force and excessive impact. So an extended knee can increase the forces generated by the body and increase injury potential. So that is more. So you want, it doesn't depend what type of foot strike is, but you want it to be as close to the body as possible. So here you can see they're going with a straight knee. When you land, you want to get some shock absorption. So you want a little bit of bend knee, which will help in the shock absorption and reduce the strain on the passive structures in your foot and mainly on the knee as well. So that's the main thing. So the knee pain and shin splints like medial tibial stress syndrome, we are looking at overstride, we're looking at the cadence, and the most important, we're looking at a straight knee. So we don't want a straight knee, we want slightly bent knee like here, and also vertical bounce, whether they're bouncing up and down, and excessive forward lean as well. So there's a lot of factors to be looking there. And let's explore this concept more. Is here, which we can see the overstride. So we can differentiate. One, you put like a line from the center of gravity and take it further. So the further away it is, you're going to see that is going to put more impact forces. And for me, the most important variable is the knee flexion angle. So ideally, you don't want the knee to be straight. You want a little bit of 10 to 15 degrees flexion here. And we also want that sort of less dorsiflexion. So for me, of those three variables, the most important is the knee flexion angle. So we look at the horizontal distance from the foot to body center of mass and see how much is the distance. The knee flexion angle at initial contact is measured between the midline of the thigh and the midline of the leg. So ideally, we're looking at to 10 to 15 degrees. So foot inclination angle is the angle between the running surface and the sole of the running shoes. So a normal tibial angle, we are looking at around 0 to 5 degrees at contact, and sort of this is quite important. So I think what we are looking here is the distance, we're looking at how much the knee flexion, and we're looking at the foot angle. So those will give us an idea of how much impact forces we are going as well. And the foot strike, so let's look at the foot strike here. So when you look at the foot inclination angle, we can split that into two types, is the high heel strike and low heel strike. So what I mean by high heel strike is excessive dorsiflexion, and here with less dorsiflexion. So they looked at 10 runners whose impact forces was by foot strike, and what they found out was higher the heel strike, there's more impact forces. So the influence of the foot strike on impact forces. So you could have the same heel strike, but the angle will determine. So if you have more dorsiflexion and more like pointing upwards towards the sky, you have high impact forces. If it's more flattened towards the ground, you have lower impact forces. So how can we change this? Suppose you got a patient with a high heel strike. There are many ways you can ask them to change it. One is to shorten the stride, land closer to the body. We can increase the cadence, we can reduce the heel drop, we can encourage high knees. So the different ways. By far the most common is increasing the cadence or by shortening the stride. So that's something to remember. And some coaches will say there that that foot strike patterns is forefoot strike is better, midfoot strike is better, heel strike is not good. But in reality, 70 to 80% of your runners will be heel strike, and that's across the population, across the world. And even in marathon runners, we find no significant relationship between foot strike patterns and race time. So obviously, when you're a sprinter, you need to be a forefoot strike. But when you're a long distance runner, it's what you're naturally efficient at. So this is something we need to be aware of. We shouldn't really try to change the foot strike unless it's a last option. So for me, I rarely or pretty much never change the foot strike. If it happens naturally when you increase the cadence, about 20% of runners, when you increase the cadence, they'll naturally go into a midfoot or a forefoot strike. But if it happens, that's well and good. But for me, that's not the main purpose. For me, it's keeping the stride short with higher cadence, and the body will adapt to that. Changing foot strike can be quite a risky proposition because you might increase the load of your calf muscles, your Achilles and other structures. So we need to be wary of that. And again, when you look into people with pain, for example, like this study was looking into cross-sectional study looking 62 runners with anterior knee pain and 60 runners without anterior knee pain, and the heel strike pattern was very similar, which was sort of around more than 90%. So if you have subjects with anterior knee pain, it was 96, and without it was 93. So there is not really an association between foot strike with runners with anterior pain or without it. So it's a nice question. So this is something which we have to remember is heel strike is not abnormal. In fact, that's the most common. So you got the three types of strike: the heel strike, midfoot, and forefoot. We can't say at this point of time that if you look at my previous videos, different heel strikes causes different injuries. So but overall it's the same. So for me, changing the foot strike is not the first line of changing your pattern as well. For me, there are other much easier ways to change and much more effective and less risky option than asking somebody to change the strike pattern. Where so suppose we change somebody from rear foot to forefoot, their knee pain might get better, but they'll come back with few weeks or few months with Achilles pain or calf injuries. So we have to be very careful when we make changes. You can change it as long as you got time and you do some strengthening. But for me, as I mentioned before, it's not the first line of treatment, especially when I have other easy options like shortening the stride or changing the cadence, which has less complications than changing the foot strike. So that concludes a very brief overview. I've kept this video series short because there's a lot of technical information, so it gives us time to go through that in detail. So for me, I think 2D analysis is more about linking up their kinematics, the motion with injury, trying to see whether I can change the load. And the big one for knee pain and shin splints is overstride, slow cadence, and the most important element is the knee flexion angle. So ideally, when they land with the initial contact, you need to have at least 10 to 15 degrees of knee flexion to have that shock absorption. So those are the main thing, and we're going to explore those concepts more in detail in the next part, in part 2 of the practical running gait analysis. Thank you.